Antibiotic use is really common and they're a really important part in making sure our pets stay as healthy as possible. But there's an increase in superbugs, in multi-resistant infections where the antibiotics simply don't work anymore. If we don't learn to use antibiotics responsibly, we may lose them altogether. And so it's important you know these 5 top conditions in dogs and cats that don't actually need antibiotics. Hi, I'm veterinarian Dr. Alex. This is Our Pet's Health, and a lot of the time people come to see me in the clinic specifically asking for antibiotics. The number 1 condition for this has got to be diarrhea. Most cases of diarrhea are caused by just eating something that's disagreed with their tummy, and they don't need antibiotic treatment at all. After all, how often do you run to the doctor to get antibiotics if you have a bit of a tummy upset? It's the same with our pets. Simply giving them prebiotics, probiotics, a nice bland diet, avoiding salty, high-fat foods is enough to let everything settle down, and it will take 2, 3, 4 days tops for that diarrhea to completely resolve without an antibiotic in sight. Now, the situation might be different if your dog or cat is also really unwell, if they're vomiting, or if their diarrhea hasn't cleared up after a longer period of time. But those cases are really in the minority. The next disease in dogs is kennel cough. So kennel cough is normally caused by a virus, and I'm sure you all know that viruses don't respond to antibiotics. Antibiotics do nothing to kill viruses. We have to rely on the body's immune system kicking in and fighting that infection. There are some antivirals. We don't tend to use them very much in our pets. We simply don't need to. Again, a smaller subset of dogs is going to become unwell. They're going to develop a fever. They're going to be under the weather in themselves. And it may be that they're suffering from kennel cough caused by something called Bordetella bronchoseptica. This is a bacterial problem, and this will respond to antibiotics. But the vast majority of cases of kennel cough, a dog is otherwise bright and happy. They may be irritated because of their cough, but other than that, they get supportive care without the use of antibiotics. Cat flu is exactly the same and is similar to kennel cough in cats, if you like. It's caused by viruses. Calicivirus and herpes virus are the really common ones here. For most cats that are just developing a minor infection, they're going to have watery eyes, they're going to have a bit of a clear discharge, they're going to be sneezing a lot. Supportive care is all that they need to make sure that they stay hydrated, stay eating, and they are going to recover. For our sicker kittens especially, they may develop a really thick mucoid, mucousy green nasal discharge that gets really gummed up, really sore eyes. And in those cases, what happened is that virus has caused a lot of damage and a secondary bacteria has kind of taken advantage of the situation. And yes, antibiotics are useful here, but again, that's certainly not every case by a long shot. Cystitis is next. Now, cystitis in people is generally caused by a bacterial infection and needs antibiotics. In dogs, the situation is the same, although for those dogs that are suffering from an infection with something called E. coli, we can actually maybe get away with using something like Mannose D, which actually can fight that infection without using antibiotics. Only your vet's going to know that, and they're going to need to do a culture to know that that's the case. For cats, however, most cases in cats, 95% plus, are not due to an infection. It's actually due to an underlying stressful situation. And we call this feline idiopathic cystitis, feline lower urinary tract disease. There's a number of different names that have come and gone over the years, but this is a sterile cystitis. We can support them in other ways with anti-stress measures, anti-inflammatories, increasing that water intake, painkillers if they're uncomfortable, but antibiotics typically are not needed. And then superficial skin infections also don't need antibiotics. So the vast majority of kind of superficial grazes, or if the skin has become a little bit moist and a little bit infected, antibiotics are not needed. They will clear up that infection, but actually there are other things that we can do. Using an antiseptic like chlorhexidine, which can come in a wash, or a shampoo, a medicated shampoo, is really useful and really efficient and effective at getting rid of superficial infections of the skin. Now, if that infection is a little bit deeper, things are a little bit more red and uncomfortable, then it may be a topical antibiotic is needed. These are often combined with a steroid and an antifungal agent as well, and that will help clear up that infection without the antibiotic penetrating deeper into the body and affecting other parts of the body where we don't want the normal bugs that are present killed. It's only in really deep infections of the skin that systemic antibiotics are needed, so that's injections and pills or tablets. And actually, if they are needed, they typically need to be given for a longer period of time, up to 3 weeks. Now, I did a whole video answering your questions about antibiotics, and that's linked on the screen now, so click on that link. I'll see you in the next video, but until then, I'm veterinarian Dr. Alex. This is Our Pets' Health, because they're family.